Okay, so this is a CBI assessment video. So we're going to start off by looking at the drainage bags. As you can see, they're a bit staggered. So one is usually a bit higher than the other. You can see this one is becoming empty. So I need to think about replacing that soon because you never let your bags run empty. But these are 3-liter normal saline irrigation bags. I'm going to check the expiry date. This expires May 2026, so it's not expired. This one expires May 2026 as well. It's normal saline. They don't have any sediment or debris in them. I'm going to follow along. These clamps are open. My drip chamber is half full, and I can see it dripping here now, running at about a slow to moderate rate. I'm going to follow down along the tubing and look at my roller clamp. So this is where we can adjust the rate of the how fast the CBI is running depending on the drainage that you have in the doctor's orders. And then I can see that it's running into the patient. I can ask the patient if they're having any pain, because the first thing you want to do if they complain of any sort of abdominal pain is checking your output, which we'll do that now. So we're going to check the urinary meatus. Is there any sort of drainage around the site? Going to follow along my Foley here. So as you can see, it's a triple lumen, not a double lumen. And I can look at the size here because the sizes for CBIs, the Foleys, are a lot bigger than your regular sizes. So they could be a 20 or a 22 just because there is the potential to have blockage. So a bigger tube is a bit better. And then I'm going to follow along my tubing here. While this is running, I'm going to make sure that it's filling up. So as I can see that there's output coming into the drainage tubing here. And this is where I assess the color of the drainage. So this is serosanguinous drainage here that I see. I can see the normal saline that's running into the patient dripping down here and filling up. And then it's going into the drainage bag. So this is the color we look at to determine how fast or slow we're running the CBI. If it is really red, you see a lot of drainage, you see red drainage or sanguinous drainage, you probably want it to run faster because that means that there's bleeding going on. If you see that it's clear or pink, you can probably slow it down. Then I'm also going to look at my drainage bag here. As you can see, this is a 4-liter bag. It's a lot bigger than your regular Foley bags. So here I'm just looking at the amount. Something to keep in mind is we really cannot measure urine output while a CBI is running because that normal saline is going into the bladder and coming out this way. So this is just knowing we need to empty it frequently, and it's usually big steel pails that we use to empty that. Okay, so make sure you're checking this frequently, especially if the CBI is running fast, as this can fill up really quickly and you don't want it to overflow. So you're emptying it frequently. Sometimes you're emptying these bags almost every 20 minutes, depending on how fast it's running. So the faster it's running, the more frequently you have to change these bags. So there's some complications that can go on with CBIs. So again, you ask the patient, are you having any pain? And if they say, oh yeah, I'm having a lot of pain, you do your pain assessment. And then the first thing you want to do is assess the drainage output. So if there's drainage output that's coming through here and you see, wow, there is fluid coming out, then that means that they most likely have bladder spasms. So that can happen with a CBI. And what we do with bladder spasms is we give them a suppository that's called a B&O suppository or a belladonna and opium suppository, which is an antimuscarinic medication and a opium. And we give it up the rectum, and that's supposed to help ease off the spasms that they're having. Now, if they're complaining about pain, and I assess the CBI drainage bag here, and I don't see any output, well, that's a problem. The first thing I want to do is clamp off my CBI so no more drainage is coming in, because I see that there is no output coming out in here, and I don't want this to keep running as it can fill up the bladder and cause a lot more pain. Because what's happening now is if you see no drainage coming out is that there could be an obstruction, and that obstruction would be from a clot that could potentially be lodged in the Foley here. And what needs to happen there is that you need to collaborate with an RN to hand irrigate. Now, always check your policy at the hospital, because sometimes now in some areas LPNs can hand irrigate, but always check your policy. The last thing I want to show you is that you may get an order to discontinue a CBI. So how are we going to do that? Well, you can clamp off these, you're going to clamp off your roller clamp, and you have to disconnect here. So what you need to get is a catheter plug. So again, this is if you get an order from the doctor that says discontinue the CBI. So this is a catheter plug. So what you have to do here is open it up, ensuring it's sterile. Okay. You are going to take out this tubing here, or what I'm going to do is have this in my hand. Take out this tubing, take this catheter plug, plug it in here, and then take this and cover it up here. And now you can hang this up here. Now again, this is only if you get an order to discontinue the CBI, and that is how it's done.